Hey everybody, I'm here with Dr. Jeffrey Sherman over at Prime Wellness. You can find them at stayyoungforlife.com. And so we're here to talk about ED, some of the common causes and misconceptions with it. So Dr. Sherman, thanks so much for joining us today. I really appreciate it.
Thanks for having me.
Definitely. Yeah, and I wanted to start off just by asking how long you have been in the men's health space and then specifically with ED.
So we've been practicing since 2015, mostly with hormone replacement. Started with testosterone replacement therapy, and most of our males would come in with, seeking out TRT and hormones because they had erectile dysfunction issues. And so that's how we sort of got involved. It sort of moved us into looking for different avenues to treat erectile dysfunction. And one of those methods was using GainsWave or Shockwave therapy.
Gotcha. Okay. Yeah, and it's been really incredible to see how far the treatments have come, and really just I think the education too, and patients realizing, there's a difference between I'm just getting older versus, I have some issues that I need to go address, and we can really optimize our health versus just kind of dealing with how we feel.
Yeah, most of the time people just ignore this problem as being, a normal part of aging, but we're seeing more younger people having issues and sort of feeling embarrassed about it.
Yeah.
And we realize that a lot of guys have a problem and don't address it. And when you address it, there's treatments that you can use that can help you or help them. And we have a very good success rate with our different therapies that we use.
Yeah, that's awesome to hear. Yeah, and I think, for a lot of guys too, they can get to feel like, well, I'm just being lazy, I'm not trying enough, I just need to change certain things and it'll get better. But obviously, if you have like an actual medical issue going on, then you're going to need to seek treatment, like with what you guys offer.
Exactly. Yeah.
And I wanted to find out from you too, what do you feel like it is that, ED specifically really isn't something that's talked about a lot between patients and their primary care? It's one of those things that, I think if they do bring it up, they're just getting prescriptions for Viagra and stuff like that.
Yeah, for a long time there wasn't a whole lot to treat. They didn't. Most mainstream medical offices just have one tool in their toolbox, which is tadalafil, Cialis, Viagra, and they just brush them off and say, here, take this medicine, next patient, kind of thing. When you're actually seeing somebody who specializes in treating these types of problems, we spend more time. And unfortunately, a lot of the patients will see their primary care providers for this problem, and they're more interested in looking at treating like cardiovascular disease, high blood pressure, heart disease, which is a really and it's interesting because that's a lot of the cause of these types of problems. It stems from blood vessel problems from those issues. There's also, psychological anxiety and other issues that surround this, and that you have to address those issues.
Yeah,
So,
absolutely. Yeah, and I think, we've gotten so focused on just trying to fix those really bad health conditions, which understandably so, but I think we just kind of get back to that middle range and just say, okay, well, I'm good now. We're not even gonna try to address and really get past that and really be optimized from there.
yeah, they put band-aids on the problems, and that's oftentimes, when you get to the gist of the situation, the core of the situation, it's easier to fix things in all of healthcare, really.
Yeah, absolutely. And so what are some of the main treatments and modalities you would focus on for patients that are struggling with that?
So if a patient has issues that stem from blood vessel problems, we look at improving blood vessel function. And that's really where these medications like Cialis, tadalafil, Viagra, sildenafil, these medications basically improve blood flow. So, and that's why they work, but they're actually heart medications. There's other ways to improve blood flow. There's nitric oxide boosters. There is, medications that improve blood flow, but there's also, mechanical treatments like shockwave therapy or GainsWave, which help to break down plaque and improve blood flow in the penis and improve erectile function. It's a form of lithotripsy. I usually explain it to patients like this. When you have a kidney stone and there's a problem in the kidney, we use lithotripsy to kind of break down the stone. And that uses sound waves to kind of go through the skin and break down the stone, and then you get rid of the stone. And the same is true with shockwave. Shockwave's been around for a long, long time. It's great for any type of improving, a plaque development in an artery such as the penis, but it's also been used in orthopedics for treating like tendinopathies, like epicondylitis or plantar fasciitis, things that require, trying to break down the tissue to have the body heal that tissue. And that's exactly precisely what happens when you use Shockwave or GainsWave on the penis. You're actually causing a trauma to the tissue to enable the body to respond by laying down new tissue, improving blood flow, and removing scar tissue, secreting stem cells that basically repair the tissue that for years and years hasn't been functioning or hasn't worked right. Or some people have trauma to the penis that can cause problems. If you have cardiovascular disease, a lot of times people have issues with heart disease and they think, wow, the heart's a pretty important organ, right? And if you have elevated cholesterol that kind of clogs the arteries, we worry about, wow, you have heart disease, you have high cholesterol, let's worry about the heart. And what ends up happening is that the heart is an important, organ. Obviously, you're worried about that, but anywhere in your body where plaque can develop can affect those specific organs, the kidneys, the heart, and also the penis. So when an early sign of actual cardiovascular health is erectile function, because the penis is one of the smallest, has the smallest artery in the body. So when that gets plaque formation, we see it as erectile dysfunction, which could be like a canary in the coal mine, kind of enlightening people and being the first sign of some more ominous problem. But it's, erectile dysfunction is treatable with these types of medications that we use and treatments like mechanical treatment, like Shockwave.
Yeah, it's good to hear. Yeah, and I think for a lot of guys too, they might just be thinking that, they don't want to be kind of selfish and go out of their way to really fix their own health with that. And it might just be something that they should, kind of deal with. But especially like you're saying, if that's a precursor to, potentially having a heart issue, like I think it's well worth going in and getting checked out and really seeing what's going on there.
For sure. For sure.
Yeah.
Most guys are worried, when they have issues like this, they oftentimes want to kind of avoid thinking about it because it's an embarrassing thing for guys. They want to perform, they're worried that their partner might, make them feel bad for not being able to perform, but it's really a physical problem. And if they get help, then everyone's happy, kind of thing. Yeah.
Yeah. And I know for a while they kind of thought that it was really just a psychological thing. And obviously there is some, component to that. I think if you have a physical issue and you're not able to perform, you're most likely going to start having that anxiety, and it's just going to be kind of a nasty cycle.
I usually explain it to patients like this. If you imagine like a sports car, like a Ferrari car or a Porsche, or, a souped up engine, a race car, it's got a really souped up engine and it's powerful. It has a lot of performance capability. But if the fuel line is clogged or the fuel pump is clogged, the engine won't perform. At the same token, if the fuel line is fine and the fuel pump is fine, but the octane of the gas is low, the engine won't perform. At the same time, there's also the driver. So let's say the car is working, perfect fuel line, perfect octane, high octane, but the driver is afraid to drive the car or worried about the car, anxious about the car. He's not going to get the performance. So when we think about these types of treatments, we think about what can improve the flow of gasoline into the engine. That's like GainsWave, Viagra, these types of things will help to improve the flow of gasoline into the engine. But the octane of the gas is also very important. That's like testosterone replacement. So when we think about the octane of the gas, you have to have an adequate amount of testosterone for libido. Testosterone also begins the nitric oxide cascade to cause erectile function. And then, of course, the driver is going to be any psychological issues surrounding performance anxiety, because as soon as someone starts to think that they're going to not be able to function in the bedroom, that can affect it. So you've got to kind of tackle this problem on those three. There's basically three pillars of treatment that we kind of focus on, if that makes sense.
Yeah, absolutely. Definitely does. And what kind of results have you been seeing with using those treatments?
So when you address all those areas, we get 75 to 80% improvement in patients. If a patient comes in and says, yeah, if I take tadalafil or I take Cialis, I get an erection, I just don't want to take that, then they're a good candidate for shockwave therapy. We usually use a small dose of Cialis, a 5 milligram dose of Cialis in conjunction with shockwave. That is effective. And we also oftentimes, they'll come in and we have guys that are 45 to 60. We'll check their testosterone level to make sure that their testosterone is adequate and their estrogen is also in the right zone. Sometimes guys are on testosterone replacement therapy and they're not being monitored and their estrogen goes through the roof, and that can cause erectile dysfunction. Sometimes guys are taking medications like antidepressant medications that could cause it. So you got to kind of look at all these factors. Yeah. So we typically try to combine testosterone replacement, reviewing the medications, shockwave, and using, tadalafil or some sort of low dose medication to help with blood flow, as well as other mechanical devices like we use pumps to help exercise and improve the blood flow. There's also PRP injections which could improve the rebuilding of the tissue during the treatment. We use exosomes or stem cell exosomes in conjunction with platelet-rich plasma during the time we do these ED treatments with shockwave to get those types of results.
Yeah, definitely. Yeah, and I think if guys knew, number one, how many guys really do struggle with ED, and then also knew how many different treatments there were out there, compared to them just thinking that I'm the only person that is dealing with this, the only options are just take Viagra. I think that completely changes the whole paradigm of it, and they start to see that, it really is a medical issue that can be fixed.
Yeah, some people can't tolerate Viagra. Like they'll take Viagra, they'll get headaches, they'll feel very flushed, they don't like the feeling. And so they just say, you know what, I'm done. I guess, my time is up. Mm-hmm. And I've had guys in their 40s that come in and think that they're done. And then we help them, and then they're back in the game. Mm-hmm. That's what it is. Got to get you back in the game.
Totally. Yeah, you must see a world of difference with them, from the first time they come in versus, after their last treatment, as far as how they carry themselves and everything too.
Yeah, I've been doing GainsWave for many, many years. And I was one of the first to use both, the GainsWave typically, we focus in on radial shockwave, but there's also focused shockwave. And so I have both of those types of devices to help to improve the function. So we use both focused and radial shockwave devices at the same time we treat them to ensure that the method we use is going to be appropriate.
Okay. And do you typically like to incorporate the P-shot as well, or is that just based on, how severe the issue is?
Yeah, usually after the 5th treatment, we'll attempt a PRP shot to help with improving the rebuilding of the tissue. So we usually do 5 treatments to help kind of break down. I like to make kind of metaphors. So I'll usually say, you don't go into the backyard of your house and just dig a hole and put a plant in there and cover it up. Right. And then expect it to grow. And you also don't expect it to grow the next day. You can't put a seed in the ground. So what you want to do is you want to go into your backyard, you want to look at the soil, you want to till the soil, aerate the soil, put some fertilizer in the soil, water the soil, plant the seed, keep planting it, keep using fertilizer. And then after a few weeks, you'll see like a bud start to grow, and that's what we're looking for. So think about GainsWave is tilling the soil. Things like tadalafil is improving blood flow. The pump is going to help with blood flow or watering the plant, and then PRP is going to be like fertilizer to fertilize that area to help it maintain a good environment for rebuilding of all the tissue, and so that the tissue can rebuild and grow. And then usually we see an improvement after about 3 weeks or 3 treatments. It takes a while because your body takes time to heal itself. So we usually start seeing some sort of bud growing after about 3 weeks. So I'll usually say after about 3 weeks, is anything improving? And then if they tell me, yeah, I started noticing something like it's improving, that's a good sign that the rest of the treatment's going to be effective.
Yeah, it makes sense. And yeah, like we were talking about, I think for a lot of us, we can put off, getting treatment. Really, like you said, you can think maybe it's just, it's time. I'm going to be out of the game forever. What are
Yeah.
some signs and things that they can look out for if they're, not sure if they should seek treatment or just wondering if it is starting to decline?
Yeah. So if they're starting to have, they're starting to lose the erection during intercourse, they're not able to, get an erection that's enough for intercourse, so penetration. As soon as they start thinking that there's a problem, that thinking cascade can also cause psychological issues. So anytime there's stress, we have to you should address it early and see if there's help so that you don't have to suffer with this. But as soon as you start seeing some decline in the well-being, we usually see this in the 40s. Males in their 40s, they start seeing a decline, which goes along with lower testosterone levels in males.
Yeah, definitely. Yeah, and I think for some guys too, they've probably maybe even gone and gotten blood work done and maybe been told they're in, the normal range, but they're all the way down at 300, and they're being that's just normal, even though that's not nearly what you would want to be at to have it optimal.
Yeah, that's the funny part, there's tons of times guys will come to me and they'll say, I went to my doctor and he told me that my level was normal, but the normal range is anywhere from like 300 to 1100.
Mm-hmm.
And so that's a big range. And the way I usually explain that is that's the average of what people are in our population between the ages of maybe 18 and 70, So we don't want to be in the average. We want to be at the optimal level, which is that high range. So I'd like to see my males at like 900 to 1,000, maybe 1,100 at that high end of the range, so that they can, not only improve with erectile function, but testosterone has a whole host of benefits for patients: cardiovascular benefits, issues with lean muscle, diabetes. It helps with all kinds of issues: brain function, muscle function, bones, this and that. So it's really important to get all these hormones optimized, including like thyroid, testosterone. We look at vitamin D. We look at all kinds of things in the blood work that oftentimes providers that don't specialize in these treatments miss.
Yeah, absolutely. I think that's super important too. And I think, that's why it's important to find somebody that does specialize in it and really be open with them too, and willing to just kind of start that conversation too. And it really doesn't hurt to, just go in, get blood work done, kind of talk about what's going on and really see if there is areas that you can improve in.
Yeah, I mean, if guys don't want to be on testosterone replacement, we'll get some males that are in their 20s or 30s that have their testosterone that's low. Mm-hmm. And so, and those males that want, to still have a family, you don't really want to supplement testosterone. There's other ways that we can boost testosterone with medications like clomiphene, and we used to have HCG that was readily available. But we could still get that. But there's medications that we use to help boost testosterone in guys that just don't want to be on testosterone. Mm-hmm. And we can usually combine that with shockwave therapy, Cialis, vacuum pump. We even guys that don't respond to shockwave therapy, there's a medication called Trimix that we could use, which is an injection, which dilates the blood vessels, and they can use that injection before they have sex, and it usually works fairly well. It's just the problem is that you got to do an injection. Some guys come to me, they were doing the injections and they, don't want to do that anymore. And then they try the GainsWave.
Okay. Yeah, makes sense. Yeah. And I think there's probably very few guys out there that just absolutely don't care or don't want to be able to, get an erection anymore. So I think just understanding these treatments and really finding, which one's going to work best for them.
It's important. It's part of being human. It's part of being, when you're with your partner, with your wife, or your partner, part of being vibrant and having vitality is this sexual function. We see this in females too. We treat females as well. We treat female sexual dysfunction with hormone replacement, We have different types of therapies that improve vaginal function, and just like we do GainsWave. But women want to be sexual as well. So, when we treat them with hormone replacement, and just like men, we treat them with hormone replacement, all of a sudden, when they're 50 years old and they get their libido back, both parties get their libido back, they get their sexual function back, it improves relationships, and we give them their life back. So it's very rewarding in that regard.
Yeah, absolutely. I could definitely see that.
Yeah.
All right, awesome. And what would be the best way for patients to get in contact with you there?
So they can look at our website at stayyoungforlife.com, or they can call us at the office. The number is 818-703-9512. We're in Woodland Hills. They can call, and consultations for GainsWave and ED treatments are free, so you can come in, and I'm happy to talk to them on the phone. Usually patients will reach out to us, and then I'll spend as much time as we need on the phone to make them comfortable and feel that this is the right place for them to be, and then they come in for the examination. We sometimes do some ultrasound testing to see blood flow in the penis and see if there's any plaque development with an ultrasound device. But usually by the history, we can typically tell patients that are going to be the right candidates for this type of treatment.
Yeah, so you can give them a good idea before they start if they're really going to respond well to it.
Yeah, I want people to respond well to any treatment that we do. So, the key is patient selection. If a patient hasn't had an erection for, if they come in there, I've had guys that come in their 80s and they want to have an erection again. And it's very difficult if they haven't had an erection for years to all of a sudden, get an erection. And also they have to have a partner. So some guys come in and they don't have anybody to play with. So, you want to make sure, because there's that the psychological, that physical stimulation. So it's mental, it's physical, it's hormonal. All these things have to go. So, we try to make sure that patients who come in are the right, will benefit. But one way or another, whether it's Trimix, medications, Shockwave, we can usually help people get an erection.
Definitely. Yeah, that's good to hear.
Yeah.
Awesome. Yeah, those were most of the questions that I had for you. Was there any last advice or anything you wanted to leave them with if they're thinking about these treatments?
Yeah, just if you think you might have an issue, even if it's mild. Some guys come in and I've had patients that are in the adult entertainment industry, and they don't have any problems, but they want to improve their function. So they can come in, and guys that even don't have any issues with erectile dysfunction, I just want to make the erection more vigorous and bigger. Shockwave will improve the function. You got to remember, we don't, it takes years and years and years before you start being sexually active, and then for years you're sexually active, but you can have trauma that develops and scar tissue that develops in there. So these types of treatments like Shockwave therapy, GainsWave therapy helps to remove that stuff and improve the function of the erection and the penis in general. Yeah. We help with Peyronie's disease as well. So patients that have a bend that is usually made by scar tissue, there's several treatments. But Shockwave can help with improving any change in shape, like the bend in the penis. That's called Peyronie's disease. Shockwave can break down the scar tissue, which causes that bend in the penis. So that's something that could be looked at as well.
Definitely. Yeah, that's really good to hear. All right, awesome. Yeah, well, I love the work you guys are doing there, and I really appreciate you taking the time to talk with us today and share the education. So thank you for doing that.
You're welcome. I'm glad to help.
Yeah, absolutely. All right, have a great rest of your day.
You too. Thanks.